Good afternoon, my world people. As I always, or as it's always my policy, I always start by welcoming you back to this important channel. And I always start by appreciating you people for the support you are giving this channel. I always thank each one of you for whatever little you are doing, be it by subscribing, liking, and sharing these videos, because you form part and parcel of the family, and anything you are doing to this channel makes it grow bigger and bigger and push it forward. For the returning subscribers, I always appreciate you too for the good job you are doing, because if it were not for you, this channel could not be where it is today. And for those who are finding it necessary to give out topics for them to be discussed, feel appreciated too, because you are part of us and you always give me guidelines to go by the most important conditions. I always choose the condition that has been requested by so many people, because it means it's hurting the community at large. I don't mean that your topic will not be discussed, even if it's a topic of two subtopics. All the topics will be discussed. And I feel so much grateful because the community is appreciating my work at the moment. We are still discussing about kidney failure, which has been one of our longest topics we have ever discussed. We start looking about chronic kidney failure. We came to acute kidney failure, and today we will start by looking at risk factors for acute kidney failure. What can cause acute kidney failure? Risk factors for acute kidney failure. We say that acute kidney failure is whereby your kidneys lose their function suddenly. I know by this moment, each one of us can differentiate between chronic kidney failure and acute kidney failure. And for the purposes of the newcomers, chronic kidney failure occurs over a long period of time, slowly by slowly, bit by bit. But when it comes to acute kidney failure, it's always suddenly. We say that chronic kidney failure is irreversible, it can be reversed. But acute kidney failure can be reversed when treated intensively. So let's look at the risk factors to acute kidney failure. The chances of acquiring acute kidney failure are greater if you are an older person. The chances of acquiring acute kidney failure are greater if you are an older person or if you have the following problems. Let me repeat this again. The chances of acquiring acute kidney failure are greater if you are an older person or if you have the following problems. Number one, or conditions or problems that can predispose you to acute kidney failure. Number one, kidney disease. This is affecting directly the kidney. Kidney disease. Number two, liver disease. Number three, diabetes, especially if not well controlled. Number four, high blood pressure. Number five, heart failure. And number six, morbidity or morbid obesity. When we were starting this topic, we stated that there are two main causes of kidney failure, which were high blood pressure and diabetes. So whenever we are talking about any cause, be it in the chronic or acute kidney failure, high blood pressure and diabetes must be mentioned. So let me repeat again the conditions that can predispose one into getting acute kidney failure. Number one, kidney disease. Number two, liver disease. Number three, diabetes, especially if not well controlled. Number four, high blood pressure. Number five, heart failure. And number six, morbid obesity. A point to note, if you are ill or being treated in a hospital intensive care unit, if you are ill or being treated in a hospital intensive care unit, you are at an extremely high risk for acute kidney failure. Being the recipient of heart surgery, abdominal surgery, or bone marrow transplant can also increase your risk of getting acute kidney failure. Let me repeat this again, which is a very important point to note. If you are ill or sick or being treated in a hospital intensive care unit, you are at an extremely high risk for acute kidney failure. Reason being that when you find you hear somebody going to an intensive care unit, it means this person is very, very sick. So you are at a greater risk of getting sudden loss of kidney function or what we call acute kidney failure. So being the recipient of heart surgery, abdominal surgery, or bone marrow transplant can also increase your risks of getting acute kidney failure. Let's look at the symptoms of acute kidney failure. How will somebody present if you are having acute kidney failure? Number one, bloody stools. Your stool may contain some blood. Number two, breath odor. Also, you will be having a bad breath. Number three, slow or sluggish movements. Number four, fatigue. Number five, generalized swelling, stroke fluid retention. Number six, pain between ribs and hips. Number seven, hand tremor and bruising, sorry, bruising easily. Number nine, decreased appetite or loss of appetite. Number 10, changes in mental status or mood, especially in older adults. Next point, we have decreased sensation, especially hands and feet. Number 12, prolonged bleeding. Number 13, seizures. Number 14, nausea. 15, vomiting. Number 16, high blood pressure. Number 17, metallic taste in your mouth. Let me repeat this again because this is very important. Symptoms of acute kidney failure, or how will a person who is having a sudden loss of kidney function, how will this person present? Symptoms of acute kidney failure. Number one, bloody stools or stool that is containing blood. Number two, breath odor. Breath odor. Sometimes we call it smell of acetone and all that. Number three, slow or sluggish movement. This person cannot do his duties as fast as you may expect. That is why we are saying slow or sluggish movement. Number four, fatigue or feeling of tiredness. Number five, generalized swelling and fluids retention. So this generalized swelling of the whole body, especially starting from the feet, it is because of accumulation or retention of fluids. Remember we said that kidneys form part of the regulation, or they assist in regulating fluids in your body. So if your kidneys have failed suddenly, they will not be able to eliminate the excess fluids, and this will lead to fluid retention and swelling. Here we are talking about generalized swelling. That means you may have swelling all over your body. Number six, pain between ribs. Num- Pain between ribs and hips. Number seven, and tremor. Number eight, bruising easily. Number nine, decreased appetite. Number 10, changes in mental status or mood, especially older adults. Changes in mental status or mood, especially in older adults. Number 11, decreased sensation, especially hands and feet. Number 12, prolonged bleeding. Number 13, seizures. Number 14, nausea. Number 15, vomiting. Number 16, high blood pressure. And number 17, metallic taste in your mouth. Metallic taste in your mouth. Let's look at diagnosis of acute kidney failure. How will you know that a person is having acute kidney failure? Diagnosis of acute kidney failure. If you have acute kidney failure, you may have generalized swelling. That is a very important point to note in diagnosis of acute kidney failure, that if you have acute kidney failure, you may have generalized swelling. The swelling is due to fluid retention. Remember, your kidneys are not functioning the way they should be, and they are not eliminating the excess fluids. So the swelling is due to fluid retention. Results of laboratory tests may also show abnormal values which are new and different from baseline levels. Results of laboratory tests may also show abnormal values which are new and different from baseline levels. For example, if you do the kidney function test, it may show values which are not varying. Some of these tests, or some of these laboratory tests, include blood urea nitrogen. These things we discussed them all. Blood urea nitrogen, or BUN. Number 2, serum potassium. Number 3, serum sodium. Number 4, estimated glomerular filtrate rate, or EGFR. Number 5, urinalysis. In urinalysis there is creatinine clearance. And number 6, serum creatinine. Let me repeat these tests again. Some of these laboratory tests include blood urea nitrogen, or BUN. Number 2, serum potassium. Number 3, serum sodium. Number 4, estimated glomerular filtrate rate. Number 5, urinalysis, which will indicate the rate at which the creatinine is being cleared from the systems. Number 6, serum creatinine. This marks the end of our video today. Thank you for the subscriptions. Thank you for the likes. And those who are sharing, I also appreciate you. So let's continue supporting this channel so that it may grow to greater heights. Let's enjoy our day. Bye bye.